The Canadian Association of Clinical Thermography is dedicated to making thermography more accessible and available to those who seek it. Become a supporting member today and help us transform the way medical thermography is understood in our world by practitioners and the general public. Visit us today and join us.
All righty. So welcome to this month's practitioners webinar series. Welcome to all the practitioners. Welcome to those of you who are not practitioners, but are interested and committed to learning about more health information and ways to keep yourself and others that you love well. Today, we are going to be talking about the lymphatic system and thermography and how thermography can support you in understanding ways to keep your lymphatic system healthy. And I'm going to share with you about Alexander Mostovoy in just a moment. But first, I want to say if you have any questions, please hold on to them until the end. There's going to be a Q&A session. And if you look at the bottom of your screen, you'll see Q&A. Just simply click on that and put your question there, and I'll hold it till the end of the webinar. All right, so a lot of you know Alexander Mostovoy, and some of you have met him. You've had the pleasure of meeting him as your thermographer or maybe as your homeopath. For those of you who don't know him, Alexander Mostovoy is a distinguished clinician, author, and researcher, and is acknowledged for his unparalleled contributions to breast health, cancer prevention, and clinical thermography. With over 20 years of experience in homeopathic medicine, he's been focusing exclusively on medical thermography since 2016. He's successfully shared his expertise, providing lectures across Canada and the US, South America, and Europe, training numerous professionals on breast cancer prevention and thermographic techniques. Among his many accomplishments, Alexander Mostovoy is an Amazon best-selling author of the book Breast Cancer is a Preventable Disease, and he was instrumental in orchestrating the 2016 Breast Cancer Prevention Global Virtual Conference, which garnered attention from over 5,000 international participants. Professionally, he has pioneered and directed an integrative health clinic in Toronto, where he introduced the innovative breast thermography method and has been doing that for approximately 25 years now. As the visionary founder and CEO of Thermography Clinic, Inc., he expanded the venture to over 30 global locations, serving more than 60,000 women. He's an alumnus of the Homeopathic College of Canada, with a doctorate in homeopathic medicine and science, and is among the few board-certified clinical thermographers in North America. He's currently the president of the Canadian Association of Clinical Thermography. His voice has echoed through multiple television and radio appearances, and his insights have been published in numerous health periodicals, showcasing his dedication to the field and the well-being of patients worldwide. So without further ado, I want to have this passed over to Alexander Mostovoy, and we will begin.
Thank you, Tally. I think we need to shorten our introduction. It takes a lot of space, and we could be talking about other things. So welcome, everyone. Welcome to spring. Spring has sprung, and we're going to be looking at lymphatics today. Why lymphatics? Because I think it's one of the most misunderstood systems in human anatomy and human physiology. So, well, let's dive into this. Here we go. Maybe not. There we go. So, welcome to thermal imaging and lymphatics. We've chosen this subject, and without even knowing, as I mentioned, that spring is usually associated with renewal And with Newell, we're going to be talking about lymphatics from different points of view. Many of you are familiar with the subject, especially the ones who are medical professionals or health professionals, and many of you, I suspect, have heard about the lymphatic system, how important it is. So if you allow me just a little introduction into what is the lymphatic system and what is this all about. So the lymphatic system is a network of organs, vessels, tissues. Basically, they work together. They create this colorless fluid, which is lymph, and it's going to go back into your circulatory system. In other words, your bloodstream. So it's kind of like someone mentioned that lymphatic system is like a sewer. I'm not sure that I agree with that analogy, but I understand what exactly they're talking about, because things are getting kind of cleaned up in the lymphatic system, and then it gets back into the circulatory system. Now, the important thing about lymphatics is that it's an integral part of the immune system. And what does that mean? It means that the immune system uses the lymphatic system to protect us from infection. It also will use the lymphatic system to kind of get rid of the abnormal cells. It also functions in terms of fluid levels. It also even functions in your digestive tract in terms of absorbing fats, fat-soluble vitamins as well. So it's a fairly complex mechanism, and that's why I wanted to give a little bit of an introduction how intricate and complex the lymphatic system is, and eventually we'll come to understand the use of thermography with regards to this very complex but very important system that we have. Now, just to give you some illustration, I'm not going to go through each and every one, but I'll just basically say that, as you can see based on this illustration, the fluid balance, the function is connected to the circulatory system. We'll come back to this in a few minutes. As I mentioned, it has to do with a lot of kind of digestive system in terms of fat absorption, and again, debris, cellular debris, and pathogenic organisms. In other words, the invaders, bacteria, sometimes viruses, maybe, which are called pathogenic organisms, are also going to be kind of dealt with by the lymphatic system. So you can see that based on this particular illustration here, it's just about everywhere you can think of. There are some connections, there are some connections here. There are certain areas like the breast or the supraclavicular regions, here in the kind of inguinal lymph nodes, also very important. So there's a little bit more concentration in certain areas than others. But again, this is not a complete illustration. We'll kind of try and kind of understand where it plays an important role in terms of aiding and abating our overall immune system. Now, components. These components include lymph nodes, lymphatic vessels, lymph fluid, tonsils, spleen, and thymus. So the lymph nodes basically act like filters. They trap and destroy pathogens. It's like a locking system where things get in, but they can't get out. And we'll get into the process with a little bit more detail, but just kind of give you an idea. It's a lock. Okay, once the pathogen is locked in, yeah, the immune system sends in B cells, T cells, N cells, all the so-called killer cells, and that's where they're going to be destroyed. The vessels transport lymph fluid through the body, right? And then they will carry immune cells and they will take out waste products. Spleen will filter blood, tonsils, thymus will contribute to immune response by producing immune cells, okay? So understanding this intricate balance is basically, I understand I'm just giving you a very, very kind of brief and a short synopsis, but it's connected to what we're going to be looking at with regards to lymphatic disorders and diseases. Now, since most of our kind of audience today, I presume, although I don't see you, but I think most of you are women, I want to start with a very important subject. How does lymphatic system connect to your breast health as well? As you can see here, here's a very good illustration of the blood vessels, fatty tissues, ducts, lobules in the breast. Now, if you look here, if you follow my cursor, you'll see that the lymph nodes are in all the way in and around kind of the breast, the areolar area, and they act as a also draining mechanism, if you wish. So they will transport toxins, and they will also kind of get them out of the area into liver and kidneys for excretion. By the way, this area is extremely sensitive to pressure and compression. So before I forget, if any of the women here are still wearing wired bras, please consider that the wire is going to be basically disturbing the lymphatic flow or even occluding in some cases, and there's going to be a buildup because of this. Never mind, there are other issues wearing kind of metal close to your skin, but I just wanted to kind of to give you an illustration where we have a lot of questions, what bra should I use? Definitely do not use wired bras. Now, the system, how does it function? Basically, it removes the interstitial fluid. It absorbs, transports fatty acids from the digestive system. It transports white blood cells from lymph nodes into bones. It transforms cells from lymph nodes where the immune response is stimulated. So what stimulates that immune response? Well, here's a very good illustration. If you're looking at, it's kind of like a loop. And what this loop is about? So the loop is going to be carrying fluid towards the veins in the neck and towards the heart. And the fluid only flows towards the heart. So it's a one-way system. Very important to understand that the lymphatic kind of structure is very closely associated with vasculature, right? And it kind of follows vasculature as well. And when we look at the body scans with thermal imaging, primarily, a lot of heat is going to be lost through vasculature, through blood vessels. And because the lymphatic system is closely following the vasculature, we may kind of understand that it may not be even the vasculature, but it could be the lymphatic system or lymph nodes that are giving that particular symbol to where it's starting to change temperatures. Well, I'm getting a little bit ahead of myself, but I'll show you an illustration of what happens exactly. So the lymphoid organs, there are two kind of things here: primary, secondary. Primary are going to be bone, marrow, and thymus, and secondary are going to be lymph nodes, spleen, tonsils, lymphoid nodules, yeah, and even appendix. Appendix for many years was not considered to be of any importance. As we know, things change. Appendix is important. The same thing goes for tonsils, which are also part of the lymphatic system. So if you have your appendix, please keep it. You may find some use for it. Here we have an interesting kind of illustration as well. So as I mentioned, tonsils in the pharyngeal region, including adenoids, which is not part of this illustration, thymus. Now, thymus gland is most active during youth, it's true, but thymus gland is very, very central to the whole kind of idea of well-functioning immune system. Spleen, then we, as you can see, we have lymphoid nodules all around the intestinal wall as well, and a little kind of appendature called the appendix. All of this is basically designed to gather and destroy infectious microorganisms, so what we call pathogens. They trap them, they bring in killer cells, and they destroy them. Then they have to get rid of them. Thymus, as I just mentioned, basically provides a place for lymphocytes to mature. Okay, lymphocytes are these killer cells that are necessary for this function. It also produces several hormones, but we're not going to be talking about hormones today. We were talking about them last time. I remember that was an interesting discussion. If you have received a copy of the past presentation on hormones and thermography, you may want to review it, or if you haven't, let us know. We'll be happy to share that with you. Lymph nodes. I think many of you, or at least some of you, have had the experience of when you have an upper respiratory infection, where you would have a swollen lymph node in and around your neck area, just kind of in the submandibular region. And sometimes when you have proper kind of physical exam, your doctor will come and examine specifically these areas and a few other areas as well. And sometimes they're swollen. The reason they're swollen is not that there is a problem. Actually, it's a sign of a well-functioning immune system. As I mentioned, the antigens or the killer cells are getting activated, the B cells, T cells, which are called lymphocytes. They are then moved into this area to deal with the infecting organism. Coming back to spleen, what's this? What is this all about, and why are we talking about spleen for a long time? Because again, it has a very kind of important function. First of all, just like lymph nodes, it cleans the fluid, and spleen filters the blood. It's imperative to understand that the B cells and the T cells, the white cells, have to be detected because they can't just be anywhere. They have a specific function of immune kind of defense. And finally, spleen holds on to your red blood cells, which you also need for proper kind of body function. So if you want to think about the lymphatic system, think about primarily it's a filtering process. What I mean by filtering process, there we go. Oh, sorry. Need to come back. So 99% of all antigens are removed. Okay. Once in a while, we do have a problem with an infection here and there. So that's just only 1%. Imagine that 99 or 9.9 times out of 100 or out of 10, you're actually averting a disease or averting an infection, if you wish. So the T cells may actually spend 20 hours in the lymph node, and B cells may even be there longer for 30 hours in the lymph node. And what they do there, as I mentioned, they are gobbling up bad guys that are not supposed to be there. There are several well-known disorders, and these disorders could be sometimes problematic. So lymphangitis, inflammation of lymph vessels, mononucleosis, which is caused by Epstein-Barr virus, very, very common. And it's not just, mono used to be called kissing disease with teenagers or young adults. It's a little bit more complex than that. When people, anyway, I don't want to kind of get distracted because it's a whole new subject when it comes to Epstein-Barr. Not everything that's being checked for Epstein-Barr sometimes comes back negative, and yet there are different variations to this particular virus which are not being detected properly. But that aside, so what happens there is that it attacks B lymphocytes, and therefore it's causing kind of a depleted reaction by your immune system. And that's why mononucleosis may take a long time to get over because you're susceptible. Hodgkin's disease, and that's really a malignancy of lymph nodes, also can come with so many different variations. Now, non-Hodgkin's lymphoma, and that's basically uncontrolled multiplication or metastasis of undifferentiated lymphocytes. In other words, kind of a screwed up system where your killer cells are turning against you. Not necessarily an autoimmune response, but they just continue to wreak havoc with your own system. Here's an interesting depiction of lymphedema. So what you see here is actually quite fascinating. What you see is usually when someone has a mastectomy, as you can see on the right breast mastectomized, that's where you will see edema. But in this particular case, the edema is on the left side. And when I say the left side, that's anatomical left side of this person, which is quite unusual. So what that may say is that maybe there is a recurrence, maybe there's something else that's going on. But this kind of an interesting combination of what's going on with lymphoedema. Hodgkin's lymphoma, as I just mentioned, sometimes presents like this. That's kind of a very, very kind of common way of seeing Hodgkin's. But that's not the only presentation of Hodgkin's lymphoma. As I said, it could take many different variations on how it presents itself. Sometimes hard to diagnose. Lymphoangiosarcoma. So sarcoma, as everybody knows, is a type of malignancy, and lympho, it's lymph, and angio is blood vessels. So again, quite obvious something is going on here. also not a pretty picture. Now, of course, there are many different lymphatic disorders. So I just wanted to, sorry, let me just turn this thing off because it keeps bugging me. Just 1 second. There. Lymphoedema is one of them. And that's a condition involving, well, I guess it didn't work. That's a condition. That's a condition involving the swelling of body parts. Hodgkin's lymphoma, a type of cancer. Non-Hodgkin's lymphoma, another kind of type. As I said, it basically deals with white blood cells. Lymphadenitis, inflammation of lymph nodes. Lymphangitis occurs when lymphatic vessels become inflamed due to infection. Castleman's disease, rare disorder characterized by abnormal growth. Lymphocytosis, where there's an increased number of lymphocytes. And Kaposi's sarcoma, another type of cancer involving the lining of the lymphatic vessels. Naturally, we're not going to go through all of them, but I may kind of give you a clue where thermography comes in with regards to helping to diagnose, as well as the primary kind of objective here is also looking in terms of following up on treatments as well to see whether or not they're effective. So traditional imaging, lymphoangiography, lymphoscintigraphy, and ultrasound. You want to add MRI here too. Some of these, one is basically a contrast agent. Lymphoangiography uses a contrast agent, and then that agent is getting kind of being X-rayed so that they can see. Now, these contrast agents are not something I would want to put into my body unless it was absolutely necessary. And the same thing with radioisotopes, which basically radioactive material to track the lymph flow, also to detect abnormality. Again, it's not something I would want to put into my system. Finally, the ultrasound. The ultrasound is definitely fairly benign, not always kind of accurate, but very useful. And the same thing with MRI. Again, a lot of people think that it's a benign technology. It's not, because it inverts cellular polarity. But again, we're not going to get into looking at all these things in detail. All I can say is that, like any technology, it has its advantages and disadvantages. And we'll go through this as well later on. Now I want to introduce kind of thermal imaging to the ones that have been with us or have had thermography. I think it's going to be fairly understandable. The image that you're looking at is very kind of simplified. So different temperatures are represented through color gradients in the thermogram, right? And that is the basic kind of understanding. What is thermography? Just looking at the surface of the skin and how it presents with different temperature variations. Now, how does it work in terms of medical diagnosis? So first of all, again, those that haven't been exposed to thermography, just kind of a brief introduction. Your skin, your body naturally emits radiation. That radiation is captured by the infrared camera, and that is then converted to a visible image. That visible image has a spatial distribution. In other words, different colors present with different temperatures, and that is called a thermogram. Okay, that's a very kind of quick introduction to how things work. Now, the advantage of thermography is that, first of all, it's not invasive. Nobody is radiating you. For a change, you're radiating us. So it does not require any physical contact. And again, there is absolutely no risk of repeating this procedure as often as needed. It's not like a CT scan where you are being bombarded by 60 or 70 X-rays at the same time, which is wonderful to see, but at the same time, radiation is cumulative, and no amount of radiation is safe. What thermography also provides is rapid and comprehensive overview. And what I mean by that is that it gives you a very, very kind of quick visual insight into what's going on, where are the hot spots, where are kind of the leaks, when do you need to do a manual inspection, when do you need to escalate, when do you need to zone in on a particular area. It gives you a very quick understanding of what to do next. And thermal imaging is ideal to understand inflammation or any other metabolic process that may affect temperatures and the way they kind of vary in different parts of our body. So, as I said, it's non-invasive, it's safe, it detects and visualizes heat differences, okay? And that helps us to understand different pathologies like inflammation or abnormal lymph flow. If there's blockage or if there is any kind of inflammation in the particular area, we can kind of pinpoint that very quickly. The next thing is the ability to detect subtle temperature variations indicative of early stage disease. So just like when we're looking at breast thermography, just like we're looking at dental, cranial, different types of scans, we're also looking at the lymphatic system. As I said, if there is a blockage, it's going to show up with different temperature. If there is inefficient lymph flow, again, such as lymphedema, it varies in terms of skin temperature presented. And the lymphatic system, because it's part of the immune response, it will also regulate fluid levels in the body. So that again is connected to the way kind of your temperature is going to be distributed as well. So depending on the appearance, we can move into the area of interest very quickly. What about the lymphatic congestion or blockages? Here is an interesting illustration. It's not anatomically correct, but again, for the illustration purposes, we're looking at detecting lymphatic issues. We map the skin temperature variations, and abnormal heat signatures will lead us to suspect whether it's a blockage or congestion. Because once we see it, because it's very kind of visual and the test allows us to be very quick in, as I mentioned, pinpointing potential problems. Of course, they have to be clinically correlated. You may have to escalate to other type of tests, but we can quickly and effectively identify problem areas, especially if there are symptoms present there already. But hopefully we can get there before any symptoms are there. And in many cases, thermography works really well in terms of identifying potential kind of developments. So before the symptoms occur, or before at least a patient finds or starts sensing something is wrong, physiologically, there's going to be a change in many cases way prior to that. So if we can see that change in temperature, we can forewarn, and in many cases even prevent really complicated issues. Inflammation. Everybody is talking about inflammation for the past 2 decades, and yet inflammation is really a major cause of many different conditions in our body. So detecting inflammation, thermography is basically ideal method to detect inflammation in a very quick, non-invasive method, where in many other kind of instances, many things are missed. And to manage inflammation, once you manage inflammation, you can either arrest or even reverse the disease progression. So that's very important to understand. Here I want to talk about a little bit about dynamic thermography, because that's the type of thermography that Thermography Clinic and all their associates are practicing. We don't just do one set of images, we take several sets with an intermission in between to understand what exactly is going on. That gives us a better understanding, and that's called the dynamic thermography. In other words, once we put something through, we take a baseline and then a functional study. In between, there is some form of kind of minor so-called stress, and then we see how that stress affects the outcome with the functioning of the functional kind of series images. And that gives us kind of a really very good understanding of whether or not there is another process. So if you come out well, then it's a healthy response. If the response is not healthy, it raises kind of a few questions why the response is not the way it was expected. And of course, we're going to escalate very quickly because of that. So thermal imaging is a key to non-invasive and resourceful technique for the diagnosis of lymph-related diseases. A couple of case studies. What I wanted to show you is basically something here. Again, the ones who are viewing this, you may be familiar with thermal images. And if you're not, let me just take a quick second to explain what is it that you're looking at. On the side here, you see a color scale. These numbers are degrees in Celsius. Darker colors are cooler temperatures, lighter colors are warmer temperatures. So let's say if we're looking at green, that's going to be 31, 32 degrees. Reds are 34, 35, and blues are, let's say, 29. So everything is digitized based on this color scale, okay? And that's what we call a thermogram. Now, when we do kind of our analysis, everything is done as a contralateral comparison, meaning if we see something on one side, we want to see the same thing on the other side. Now, in artistic circles, I have to say that symmetry is considered to be boring, but when it comes to your health, symmetry is probably the best thing going for you. So there are some asymmetrical things that you will see here. For instance, most likely lymph nodes in and around the left part of this woman's neck are affected. But not only that, the axillary region here also gets affected, and it's warmer than the opposite side. What do I mean by that? So you can clearly see right away lymph nodes, the axilla. Let's see what's going on. So even though there may be nothing when it comes to your breast tissue here, or at least I don't want to say nothing, but in this particular case, both breasts are low risk. But because of what we are looking at with the neck and the axilla, definitely we'd want to kind of investigate further to see what else is going on in this particular scenario. Case studies, in this particular case, as I said, if you remember how the distribution, the inguinal kind of part of the lymphatic system is most likely affected. So we would want to escalate this as well. Again, you can see the opposite side is clear. Here we have some issues here. Again, if there are no symptoms present, and I would be surprised, but sometimes this person could be asymptomatic, we'll definitely want to investigate this area as well. And you can see that's very quickly to kind of to pinpoint where to go next. Here the same, this part of this person's neck is definitely way more active and affected. So we want to find out, did they have a recent cold or a flu, upper respiratory infection that may be still lingering on, or is there something else that's going on? And finally, we're looking at here before and after. So what do I mean by before and after? Well, in this particular case, you're looking at this woman came in, I believe, in 2018. And as I mentioned before, everything is done as a contralateral comparison. So I want you specifically to focus on this particular area here, where you can see it with the anterior view right around this area, the upper portions, primarily the upper outer quadrant of the right breast. The year after, you are looking at the same person, you know, she still has the same kind of warmth or even hypothermia in her kind of neck area. But you see how the whole thing has cleared up quite quite dramatic. It's cleared up quite sufficiently. Just 1 year, okay? Why? And I know the case, so I'll tell you why. Because she was put on a thing called lymphedema. Lymphedema is a combination homeopathic medicine that contains several kind of compounds of homeopathic, different homeopathics that help this person really resolve a lot of these lymphatic issues. And that was the only thing that was added to her. I know it's anecdotal, you know, we don't have a blind placebo studies and all that, but I know from my kind of previous experience that certain things work and certain things work well when they are well indicated. So in this particular case, you can see that by addressing kind of the lymphatic issues, it really had a profound effect on the overall presentation and lowering the risk factor for this person quite tremendously. So from here, we go to there, and you can see the whole thing is really resolved. Quite nice to see these things from time to time. So as I mentioned before, there's going to be a comparison analysis, and I don't want to go through the whole thing because it may be a little tedious. But as I said, with some of the conventional methods, we're looking at radio tracers. They could be either a dye or radioactive substance, not something you want to do on a regular basis. MRIs are great, but kind of access to them are limited. And then time is also limited in terms of, you may want to wait for your MRI appointment for a long time. Where thermography comes in is definitely, it's not going to replace any of the other tests. And for sure, it provides less of an anatomical detail. However, it doesn't have any risk associated, and it even helps detecting subclinical cases. What I mean by subclinical, meaning that the the diagnosis hasn't been given, and in many cases, it's still in either very early or even non-symptomatic case. So that's important thing to understand. It's quick, it's safe, and it gets to the point very quickly where you know whether you need to escalate or not now, So what is the future? The future is going to be very bright. As I said, I'm very excited. I love spring, even though it doesn't feel like it here in Toronto. We had snow on the ground, and we still have a little bit of snow out there, even though it's a nice sunny but cold day. However, as the research progresses, and I was when I was preparing for this webinar, I looked at, there are so many recent papers that are being published with thermal imaging, not just on lymphatics, but just overall. So I think that in academia, at least, there's a great interest in thermal imaging because of the potentials that I've hopefully presented to you today. And clinicians will follow. It's just a matter of time. And I think that thermal imaging definitely has not just a place, but a leading role in terms of screening for, and as well as managing for lymphatic diseases. Sorry, we just went back. We want to go forward. So in conclusion, thermal imaging is vital for early detection. As I said, one more time, it's not invasive, it's safe, and you can use this frequently. It monitors treatment effectiveness, which is great because how do you know that your treatment works? Well, sometimes you can say, I'm feeling better, but sometimes that could be kind of self-deception as well. And finally, as I said, it's an amazing thing in terms of spotting inflammation. So in summary, because we are part of the Canadian Association of Clinical Thermography, I want to kind of encourage everyone to support our association. We're doing these monthly lectures for health professionals, but it seems like we get more kind of non-health professionals, but just people who are interested in different subjects and how thermography can help their health. However, thermography definitely has a huge potential in healthcare, and we're eager to provide as much education as we possibly can. So if you have any additional questions, queries, please feel free, and you're definitely welcome to contact us. Here's your contact information, or you can call us. We're always happy to hear from you. And now, finally, we'll get to our Q&A session. So I want to thank you for your attention. I know it's in the middle of the day, and the fact that we have so many people staying with us for the whole presentation, and we've had a sellout event. I'm told that we've reached our capacity, but we also sent out, I know Tally told me prior to this that we sent out kind of a back room or a back door entrance to this as well. So thank you for your interest, and I'm really humbled by how many people registered for this particular webinars. Hope to see you next month as well. Let's get to Q&A, Tally.
Sure, sure. Okay, so we have a few questions. One, this is sort of a quick question. You mentioned the homeopathic remedy.
Mm-hmm.
Can you say it again and how to spell it?
Yeah, lymphodiral.
So
Lympho and diral.
D-Y-R-O-L?
I think, I think it's DY, lymphodiral.
Right.
I haven't used this because I'm not kind of in clinical practice for many years now, but years ago, when I used it, or I shouldn't say I used it, some of the people that I was working with used it, had really spectacular kind of results. And it wasn't just one or two, there were quite a few. So I don't even know if this particular product is still around, but if you find it, please let us know, or maybe we can use our search engine after this webinar to see if they're still around. But it was a great combination.
Great. Okay, and so got a few more questions. So let's try to go through these. Thank you for this informative presentation. You're welcome, Angela. Can you speak of what may cause a breast to leak liquid now and then, and what can be done to remedy this situation? This person has done a sonogram and everything seems to be normal, but the lab wants her to do a mammogram. And she's also asking, how do you know or how can you know if the liquid is benign without invasive procedures? So that's about breast leakage.
Right. So when liquid, I'm assuming that it comes from the nipple. So there are different types of colors to the discharge. It could be kind of whitish, it could be yellowish, it could be almost like corrosive color. Most likely may be problematic because there's maybe blood involved there. So based on the color of the discharge, you want to investigate that. So if it's not corrosive or rustic color, most of these are not really troublesome. However, you should look at checking your hormones and go from there. So again, without knowing kind of specifics, it's very difficult for me to answer the question in more detail.
Okay, great. Great. I've got a few more questions here. Question is, having tonsils out, does that, and also there's two questions that are kind of the same, so I'm going to put them together. So tonsils or appendix, you mentioned about, if you have your appendix here, but if someone has any of these removed, are they at higher risk?
Well, yeah, definitely. To some extent, the immune system is compromised. Listen, I lost my tonsils when I was 3.5. I'm still around to talk about this. So I guess there's also the human body is probably the most fascinating kind of thing that was ever created or invented or whatever you want to call it. There's going to be some form of compensation, right? Just like people that lose their sight, well, then their hearing kind of becomes more acute. So again, I can't say that definitively that there's definitely a compensation mechanism, but at least that's what I kind of aspire to believe. But no, I listen, what's done is done. I wouldn't worry about that. So the main thing is, how do you keep your immune system or your lymphatic system healthy? Okay, so again, going back to the basics. First, avoid toxic chemicals. Okay, and these toxic chemicals come from pesticides, but not just pesticides. Everybody knows about those. But let me tell you that cleaning agents are much worse. And you know, some of them you can smell quite a distance from. Be very, very careful what you use in terms of cleaning agents. And of course, pesticides and herbicides are killing us all. So try and avoid that as much as possible. Sometimes it's just impossible. Drink a lot of water. Don't drink a lot of coffee. Don't drink a lot of tea. Drink a lot of water. I'm at fault for that too sometimes. And you need to move. Okay, so especially if you have congestion, and I see this quite regularly when we do our thermography of dental cranial area, I see a lot of congestion behind the ear, kind of retroauricular congestion. And I always say retroauricular congestion definitely connects to lymphatic drainage congestion. Okay, so how do you move that? Again, move. First of all, you need to flex your neck muscles, or at least stretch them on a regular basis as much as you can, because we're all sitting in front of screens, or at least most of us, and we become stagnant. The whole lymphatic system gets stagnant. So move, but also any kind of upper body kind of movement also activates the lymphatics. And exercise, move, walk, you know, dance, you know, probably more fun than just walking, but do something to move your body. As your body moves, your lymphatic system is going to be activated, and you're moving against gravity, right? So where's gravity coming in? Because it kind of makes things more or less stagnant. So as you move, you're influencing your lymphatic system. And finally, and I forgot to mention that when we were talking about breast health, lymphatic massage. Find someone who is an expert or at least trained in lymphatic massage. You would see great kind of change in the way you feel, in the way your breast functions, in the way your lymphatic system functions. Okay, sorry for the long answer.
That's okay. Well, listen, we've just hit the 1 o'clock mark. We have a couple more questions, but what I'm going to do is, Mary, if you could do me a favor and just send me an email address that I can respond to that question after the webinar. I will do my best to get that information for you. Okay, and thank you so much. Thank you, Alexander Mostovoy, everybody. Once again, he's provided us with amazing information. I've gotten a few messages of big thanks for this informative presentation. And we thank you, because without you, we don't have anybody to present to. So thank you for taking the time to show up and to care. We will be sending out a link to the recording within a couple of days. So keep an eye out, and you're welcome to share that with anybody you'd like. All the best, and have a great rest of your day.
Thank you. All the best to everyone.